Tonight's bedtime lesson is about toothache. Now, toothache is pain in and around the teeth and jaws. It's usually caused by tooth decay. You can feel toothache in many ways. It can come and go or be constant. Eating or drinking can make the pain worse, particularly if the food or drink is hot or cold. The pain can also be mild or severe. It might feel sharp and start suddenly. It can be worse at night, particularly when you're lying down. A lost filling or broken tooth can sometimes start the pain. It can also sometimes be difficult to decide whether the pain is in your upper or lower teeth. When a lower molar tooth is affected, the pain can often feel like it's coming from the ear. Toothache in other upper teeth may feel like it's coming from the sinuses, the small air-filled cavities behind your cheekbones and forehead. The area of your jaw close to the infected tooth may also be sore and tender to touch. It's also possible for periodontal disease to give rise to a dull pain. Periodontal disease is a bacterial infection that affects the soft and hard structures that support the teeth. Speak to your dentist if you have toothache for more than 1 or 2 days. The longer you leave it, the worse it will get. If your toothache isn't treated, the pulp inside your tooth can become infected. This may lead to a dental abscess, with severe and continuous throbbing pain. Painkillers such as paracetamol and ibuprofen may reduce the pain and discomfort while you're waiting for an appointment. Children under 16 years of age should not be given aspirin. Now, what causes it? Toothache occurs when the innermost layer of the tooth or dental pulp becomes inflamed. The pulp is made up of sensitive nerves and blood vessels. Dental pulp can become inflamed as a result of tooth decay. This leads to holes or cavities forming in the hard surface of the tooth. A cracked tooth. The crack is often so small that it can't be seen with the naked eye. Loose or broken fillings. Receding gums, where the gums shrink, contract to expose softer, more sensitive parts of the tooth root. Periapical abscess. A collection of liquid at the end of the tooth caused by a bacterial infection. There are other conditions that can cause pain similar to toothache, even though the pulp isn't affected. These include periodontal abscess, a collection of liquid in the gums caused by a bacterial infection. Ulcers on your gums. Ugh. Sore or swollen gums around a tooth that's breaking through. For example, when your wisdom teeth start to come through. Sinusitis, which sometimes causes pain around the upper jaw. An injury to the joint that attaches the jaw to the skull, which is called temporomandibular joint. Babies can also experience discomfort when their teeth start to develop. This is known as teething. Treating toothache. This is the phase of how they do it. The type of treatment you have for toothache will depend on the cause of the pain. Your dentist will examine your mouth and may carry out an X-ray to try to identify the problem. If your toothache is caused by tooth decay, your dentist will remove the decayed area and replace it with a filling. If your toothache is caused by a loose or broken filling, the filling will be taken out. Any decay will be removed and a new filling will be put in place. If the pulp inside your tooth is infected, you may need root canal treatment. This procedure involves removing the infected pulp and inserting a special type of filling to seal the tooth and prevent reinfection. However, if all those doesn't work, your teeth may need to be removed if the toothache can't be treated using these methods, or the tooth is wedged between another tooth in your jaw, also known as impacted. Preventing toothache. The best way to avoid getting toothache and other dental problems is to keep your teeth and gums as healthy as possible. This may be a bit dark, so I apologize. Oh, there we are. The best way to avoid getting toothache and other dental problems is to keep your teeth and gums as healthy as possible. Here are the do's and don'ts. Do's. Limit your intake of sugary foods and drinks. You should have these as an occasional treat and only at meal times. Brush your teeth twice a day using a toothpaste that contains fluoride. Gently brush against your gums and tongue as well. Clean between your teeth using interdental brushes or dental floss. Stop smoking. It can make some dental problems worse. Now this is very important. Make sure you have regular dental checkups, and ideally with the same dentist. The time between checkups can vary, depending on how healthy your teeth and gums are and your risk of developing future problems. Your dentist will suggest when you should have your next checkup based on your overall oral health. Time for our tonight's bird.